Ramchandar. I'm a UCSD Pediatric Infectious Disease Fellow. I work at Rady Children's Hospital. Today we're going to talk about COVID variants and what they mean for you and for your family. We'll cover these questions. What is a COVID variant? How does a virus change? Which variants are in the US right now? Which variants are dangerous for children? And how you can protect yourself and your children, and whether or not the vaccines work against the variants. I'll be taking lots of pauses to let Dr. Zuniga translate. And after the slides are finished, we'll open it up for questions that you might have. So first, I want to just start at the basics and what a virus actually is. So the simplest explanation is that a virus is a collection of proteins that form an envelope around genetic material, DNA or RNA. Viruses spread by infecting human cells and forcing those human cells to make new viruses rather than perform their normal tasks. Those new viruses spread from the infected cells to other cells, and that's how you get infection. Viruses are everywhere. They outnumber bacteria 10 to 1. There are more viruses than human cells. But most viruses don't cause any symptoms, or they cause very mild disease. To replicate, a virus must insert their DNA or RNA into the human cell, and then the human cell uses that DNA or RNA to make new genetic material. That new DNA or RNA is then used to form a new virus, and that process can be very messy and inaccurate. And many of the copies of viruses will have little errors or mutations in their DNA or their RNA. And that's what a variant is. A variant is a new copy of a virus that results from one of these mutations when RNA or DNA are copied to make a new virus. Most variants have no effect on the form or the function of the virus. In fact, many of these mutations can actually make the virus ineffective or less effective. Sometimes the mutation, though, can cause the new virus to be more infectious or cause more severe disease, or both. And so what does that mean? So far, there is no information to suggest that any variant with COVID is worse for kids than adults. For most variants, we don't have any data to suggest that they're more infectious or deadly. But there are some variants of concern. The CDC has identified 5 variants of concern in the United States. The first one, B117, is also called a UK variant. B1351 is the South Africa variant. P1 is the Brazilian variant, and B1427 and B1429 are the California variants. Since January, the variants have become more common. On the left is a graph showing the spread of the variants. The proportion that they fill the bar is the total proportion of that variant causing infections. And you can see that B117 is now the most common type of coronavirus or COVID virus that's causing infection right now. On the right, Region 9 is one of the geographic areas that the Human Health Service Department divides the country into. Region 9 includes California. And B117 is becoming increasingly more prevalent in California as well. And here you can see from California Department of Public Health that B117, the blue line, now is causing about half of all infections with COVID-19. The gray line and the orange line are the California strains, and they are actually causing a smaller proportion of the infections in California right now. Transmissibility is the term we use to characterize how likely an infected person is to give the infection to someone who's not already infected. The B117, the UK variant, and B135, South Africa variant, seem to be about 50% more transmissible. To give you an idea of what that would mean, if someone previously would have had a 10% risk of passing that on to people around them, they now have a 15% increased risk. So it doesn't necessarily mean that they're twice as more likely. And that's a common misperception. P1, the Brazilian variant, we know is more transmissible, but we don't have good data to tell us just how much more transmissible. The California strains seem to be about 20% more transmissible. And that was 1427 and 1429. Oh, and I should say here, B117 in at least one study was shown to have an increased mortality rate, just a little bit higher in hospitalized patients. The same was true for B135. P1 may be worse, but we don't really know yet. It seems to cause worse disease in pregnant women. There was a report in the news that there are children dying in Brazil, but it's not clear if that's because of the virus or just because the hospitals are overwhelmed. That hasn't been shown to be true basically anywhere else in the world right now. The California strains don't seem to be more deadly than the normal strains. So, how well do the vaccines work? The vaccines do seem to have some protection against all of the major variants of concern. The Pfizer vaccine, the mRNA vaccine, has shown really good efficacy against B117 and B135, close to 90%. And it's even better at preventing moderate to severe disease. So hospitalized patients are less common after they've had the vaccine. Said another way, if you get the vaccine and you're exposed to the strain of B117 or B135, you're very unlikely to have severe disease. The relative protection of each of the different vaccines against every variant is an important question that isn't fully answered. The Johnson & Johnson vaccine, which is available in the United States, and the AstraZeneca vaccines do seem to have less efficacy against B117 and B135, though they do still give some protection, especially against severe disease. So to summarize that, the vaccine works, especially the mRNA vaccines, which are the most common ones that you'll get in the United States right now. This slide, presented by the Public Health Department, shows that as vaccines have been administered in San Diego County, the infection rate has plummeted. So this blue line is the number of people that have been vaccinated, 2.9 million doses so far. And this red line is the number of cases per day. Really striking. And so what can you do to stay safe? Get vaccinated. In order for variants to form, they have to be able to infect people and replicate. So if people are not getting infected, new variants won't be created. Also, if you are vaccinated, you are less likely to get one of those variants, you're less likely to have severe disease, and you're less likely to give that infection to someone else around you. You also want to keep following good public health practices. There's been a lot of changes with mask wearing lately from the CDC and the guidelines. But in many settings, even if you're vaccinated, a mask can still be a powerful way to protect yourself. Examples where you might still want to wear your mask, even if you're vaccinated, include settings where you can't be sure if everyone else around you is vaccinated. If you're in close proximity to people where you can't maintain your distance. If you can't be sure that people around you don't have symptoms. Or if someone of yourself or someone close to you has a condition that puts you at higher risk for severe disease. And that situation will change depending on who you are and where you're going and what things you're doing. So ultimately, you want to use good judgment. I might give the example that if you have close friends who are healthy and are fully vaccinated, you probably don't need to wear a mask when you see them. If, on the other hand, you're in a crowded market and you have some sort of health condition like asthma or a lung disease, even if you're vaccinated, you may still want to wear your mask. Especially if you're indoors. So I'll stop there